Kindly like and subscribe to my YouTube channel for more videos, Midwife Ajua. You can also leave your comments at the comment section. If you have any topic or any question that you want to ask, you can leave it at the comment section. So another minor disorder is leg cramps. Some pregnant women will feel some sharp pains at the leg area or at the calf of the leg, which is very common, especially at night. It's part of pregnancy. It's nothing new. It's part of it. All these minor disorders that we are talking about is not every pregnant woman who experiences. Some will experience, some will get about 4, 5, 6, 7. Others can experience all. Others will not even feel any one of them. It's individual differences. And what you have to pregnant women have to know is Ajua's pregnancy is not Abinet's pregnancy. Juliana's pregnancy is not Christiana's pregnancy. Each and we have individual differences. So what I will experience is not what you will experience. So don't compare your pregnancy with another person, please. And our husbands or our relatives, please don't compare us to other people. We have individual differences. What I can contain, another person cannot contain it. Or what I can bear, the pains I can bear, another person cannot bear. So when they have any complaint, don't tell them, oh, my friend's wife is also pregnant and she's not complaining, or she's experiencing the same thing but she has kept quiet. No, we don't have to do that. If you have anything, if you are experiencing any of this at higher levels, or if when you experience that whatever you are experiencing or you are feeling, it's disturbing you, no, come to the hospital, come and see your midwife or your doctor. You complain, whatever that you have to do. If it's in advance, whatever that we can do to help you, we will do to help you. So the leg cramps that I was saying, some people feel it is mostly at night. When you are stretching, you can feel that then the place becomes very stiff, that you cannot do anything. It's very painful. It takes time before it goes. When it happens that way, just rub the place, rub the calf, the place that has become very stiff. You rub your hands on it. You rub your hands. It's very normal. Then you can also, with this one, you have to eat calcium-rich foods. Calcium-rich foods like yam, carrots, milk, yogurt, green nut, green leafy vegetables. All this you have to eat it. It also helps reduce it. Then another one is abdominal cramps, which is also common, especially in the first trimester. You can feel some abdominal cramps in your abdomen, some tightening feelings in your abdomen. It's very common in pregnancy. But when you feel it, when you have it in a severe form, you have to report to your midwife or your doctor. Or whenever you have the cramp, you see spots of blood or you see a blood stain, you have to report to your doctor. Then another minor disorder is headaches. Headache is common in pregnancy. Some people, but in severe form, you have to report. When you are having this headache, you have to take enough water. Then you rest for some time. Some people, when they experience this headache and they sleep for a while, when they wake up, they will feel okay or they become normal. So when you feel it, you have to just lie down. But some people want to abuse paracetamol. Immediately they have this headache, they just go and take para. When they have it, they will just go and take para. They want to take medication. No, don't be abusing the paracetamol. If not, it's not good. Para is not good. Too much of everything is bad. So when you're having this or when you're experiencing this headache, what you have to do is you take enough water, then you sleep or you rest in a quiet place. You see that when you wake up, you feel okay. Or when after resting for a while, you are not okay, then that's where you take your para, your 2 tablets of para. It's okay, but not always. Occasionally, you take it. Then another minor disorder is feeling hot or sweating. You can see some pregnant women, they sweat a lot. Even the place is cold, there's fan on, or some in air condition, but they will still sweat. It's normal due to the hormones that has come. It's normal. Others also have mood swings. or mood changes. It's normal. They will be there. They don't just feel like talking. Others will be crying. Others will be moody, angry, depressed. It's normal. So our relatives, our husbands, please, when it happens that way, just be with us. You have to be there to talk to us. Don't say because I talked to her or I spoke with her, she didn't mind me, I'm not going to talk to her again. No, don't say that. Don't do that. Have time for us. It's part of it. That's the nature of pregnancy, the beauty of pregnancy. So have time. When it happened that way, you just be okay. When she comes back to the normal person, you talk to her as it is. Then another minor disorder is vaginal discharge. You see, as a woman, we have some discharges at our vagina area that moistens the place, that makes our vagina very moist so that the vagina wouldn't be dry. During pregnancy, this discharges increases. It increases and it helps fight infection. It's white or yellow, which is very normal. No scent. It doesn't smell. But when this fluid changes color, when it becomes green, yellowish, or it become green, offensive, and then the color changes, that one you have to report. Then there is a problem. Or when the place start to itch you, when the place starts to itch, then there's an infection. But if you don't have the color changes or the offensive smell, but it's normal, like the white or that off-white color, then it's normal. That is how it's supposed to be. That's how the vagina is. It also helps fight infection. And when you're about to get an infection, you see that the fluid in our vagina increases, trying to fight the infection itself. So when the vagina is unable to fight this infection, then that's where we get the infection. Then the place starts to itch. You have that offensive smell, or the color changes. When it happens that way, you have to report. So like I said, in conclusion, this is the minor disorders. Others people have other things that they experience, which is also normal. So whenever you have anything, you have to also report. Then you also have another minor disorder, which is edema. Edema, that is the swelling of feet and ankles. It is very common in pregnancy, especially you experience it in the afternoon or during hot weather. And this one is due to retention of fluid in the body tissue. During pregnancy, our body retains a lot of fluid, so this causes this edema in our pregnant women. So what we advise our pregnant women to do is, when they are sitting down, they have to raise their legs. So when you are sitting in a plastic chair like, then you need a kitchen stool. Then you raise your leg on it like this. As you are sitting down, then you raise your leg on it. When you are lying down too, you can also put your leg on pillow or something like that. And you see this edema, it goes away, or it reduces when you lie down, or when you wake up in the morning, you see it. And it's very common in the afternoon. Maybe that you've sat for a while, maybe due to the work that you do. Maybe you are a seamstress or something, so you sit for a long time. So we are also advise our pregnant women that when they sit for a long time, they have to get up and walk small before they come. Or if your work involves standing for too long, you have to be resting in between to avoid getting this edema. But edema in the third trimester with severe headache, let's say you have this edema, you have severe headache, it may be a sign of preeclampsia. So that one you have to report. Or when you wake up in the morning and you still have the edema, when you were going to bed at night, the edema was there, and in the morning waking up you still have the edema, it hasn't reduced in size, that one there should be a cause for alarm. You have to report. You have to come for us to assess your BP and other things, to know that you don't have any medical condition like preeclampsia. So thank you. If you have any question you can leave it at the comment section. If you want any clarification, you can contact your midwife Ajua on 0241727393, or if you are around Konongo, Agogo, you can come to Agogo Presbyterian Hospital at the ANC unit. You just ask of midwife Ajua or Alberta. You see me. If you have any, if you want to have one-on-one, we can have it. So kindly subscribe. Please subscribe. Tell a friend to tell a friend to tell a friend to subscribe for more videos. Thank you.